Hey you guys, it's Farrell. Welcome back to my channel. It is 11:26 a.m. and it is about 57 degrees. I've got my mushroom coffee. I'm just chilling. Yesterday, I got a call from the nurse. Well, not a nurse from the surgeon's office, and it was like pretty much routine. Like they do this pretty much like before surgery. It's common like 2 weeks before or so they call to confirm your medical history. So we went through all of my stuff. They had some of my allergies wrong. They said that somewhere along the line it had gotten written in there that I'm allergic to berries, which I'm not allergic to. So I corrected that. I'm like, I've never been allergic to berries. Because I don't have that many allergies. I have seasonal allergies, um, dust, like a lot of dust and stuff like that will set off my allergies. And I used to be allergic to poison ivy, poison oak, and poison sumac, but over the years I developed kind of a resistance to it, and I haven't had it in, knock on wood, like 6 years or something like that. I've done really well, even like considering like hiking through the brush and stuff like that. So we went through all of that. Um, I did have to ask because the original paperwork said to stop all medications for 2 weeks prior to surgery, and that had me a little bit stressed. I'm not gonna lie, because I have medications that I do take every single day. But it was confirmed like I can continue to take my anxiety medication. And I have like, I don't know, this might be a little TMI. I have really bad acid reflux. And it like a GERD essentially, like the big version of it. And I take Prilosec every single day, and I was so worried that I was gonna have to stop taking the Prilosec, and I was gonna have to like completely live off of the saddest foods in the world. But good news, it's not. I take, since it's a pill and it's not like chalky tums or anything like that, I am allowed to continue taking my Prilosec. They said that in cases like this where it's like really bad like reflux, they would actually prefer, as long as it's not the chalky stuff, they would prefer that you continue to take it because you don't want like extra tummy gurgly stuff happening potentially. Like it just is more helpful. I believe that the reason that they don't want you to take the chalk based um, medications is it can kind of interfere with other stuff because it like absorbs, and they don't want it to like absorb anything that they would administer to me. So that's what I think it is. Um, so yeah, that did take a lot of my stress down about surgical preparation, honestly. So yeah, that is awesome, and I'm kind of getting like nervous, and like I was always nervous about it, but I'm getting kind of more nervous because it's like, okay, so we've went through this part of it, and then the next milestone is the actual surgery. Like there's no more there's no more doctor's visits before the actual surgery. It is simply time. It is the big show. We are getting ready for it. And I think that pre-surgery jitters is completely normal, obviously. Like people get it all the time. I'm just a little bit like, I've only ever had my wisdom teeth surgery, and I wouldn't say it was the worst experience, but I really wouldn't say it was a good experience either. Um, when I had that done, I had never met the guy. Like, I've met my surgeon for this before, so obviously I do have less apprehension in the first place. But when I got my wisdom teeth done, the dude came in, and I didn't know that he was even the doctor. He came in, he sat down, he did not acknowledge me, he did not say hi or anything. He immediately just put the needle in my arm, and I was fucking out. And then I woke up, and everyone was fucking gone, and like my teeth had been removed. And then later, I ended up having some nerve damage from that surgery. And because I'm prone to migraines and stuff, whenever I get migraines, I will feel my wisdom teeth that aren't even in there anymore if I will feel them floating and it will make my migraines worse. Sort of like a phantom limb sort of situation. And sometimes I don't even need to have a migraine for it to feel that way. Like if I'm just really stressed or whatever, like I don't know why. I just feel like there's the ghosts of my wisdom teeth are pushing my other teeth around and it will really hurt. So I do have like some lingering anxieties about the potential for like, you know, like little quirky things that can go wrong that you can't really help. It's no one's singular fault that those things like really happen, and I don't think it wasn't one of the things that was brought up whenever I was asking about the risks of the surgery, etc. So I don't think it's like a major risk that it will happen with my labrum, but you know, it's the things you kind of think about when you've been at home for almost a whole fucking year just sitting and waiting for surgery to happen. Um cuz yeah, it's happening March 25th and my surgery happened on April 9th. So it's almost a full year. It's just so crazy to think about, honestly. Like, I know that healthcare is messed up in a lot of countries, and I know that insurance is weird in a lot of places, but like, all the stories that I had heard proved to be so true. Like, absolutely so true. And it's been very, it was, it was something I was passively aware of, but the fact that I've gone through all this and then like this we'll call it the situation with Luigi happened, and like all of this other stuff is getting exposed all of the time. It's just I don't know, it just kind of weighs a lot on your mind when you're in the thick of it, because I've always had, you know, like invisible disabilities to an extent, like chronic fatigue and chronic pain and a lot of stuff like this all the time, and some hypermobility and things like that. But like this, the way that I've been like dealing with my hip is considered like a temporary disability, and it is a lot more visible. Like I just walk different. Stuff about me is just different now, and I don't. It's very eye opening. I think it's very very eye opening, especially when you realize that it's not if, it is in fact when. Like you will either die before you become disabled or you will become disabled at some point in your life, and there's no real way around it. Like, and I know it's like, oh yeah, some people do just die healthy, but most people, if you live to be like very very long, like a very long life, even if it's like stuff that you would expect with age, those some of those things are still disabling, if that makes sense. And it's like, I don't know, I feel like there's not enough awareness that it really, for the vast majority of people, it's not if, it is in fact when, and that is why everybody should care about things like this more than they do. I don't know, I don't want to go off on a whole tangent about that because could be here for days, but it's, I don't know, it's just a lot, you know. Especially when like I've been depending on an insurance company, and yes, with as far as my physical stuff, they have eventually, even if they've taken 6 weeks at sometimes to respond to me, they have gotten me eventually to where I needed to go. But I have asked several times to see somebody for a referral for my mental health, and the first 3 or 4 times I asked, I was basically just blatantly ignored in correspondence. And when I finally did get an answer, it was like, okay, so if you get a referral, we will pay for that therapy. The initial referral visit to a GP is not something that they would even consider paying for, even though they had sent me to a GP at one point, and I was supposed to be seeing him every 2 weeks for updates, and I saw him once this whole year. So I was supposed to see him again, and if they had allowed me to see him again, I would have been able to do that without coming out of pocket. But because I don't have the out of pocket money to see a GP to get the referral, basically what I was told is I am up shit creek, you know? Like, and that's been really hard, not just because it's like I can't afford it, but it's because like I have needed extensive therapy throughout my life in different instances, and this is really no exception. Like, I would highly benefit from therapy. Now, I will say one thing I am considering trying to do, I don't know if this will work or not, because it's like, I'm not really into telehealth. I know therapists in real life. Well, not like known, I don't know them super closely, but like there's people that I know that are in the business, the profession. My partner's therapist, for instance, they don't agree with it. And it's not because it's like cheaper and accessible. They love that. Like my partner's therapist actually, a lot of her patients are through givenhour.com, which means they see her at no cost and she gets paid through donation exclusively. Um, like she's all for people not having to pay when they still need the help. It's because there is an issue with, they sell your data, and data isn't just like, it's not just your phone data. Like it's your information about you that people are gathering that could potentially be sold for different things. And if you're fine with that, I'm not judging you. Be fine with whatever you're fine with. But like there's also no way to know that, because it's meant to be private, the person on the other end, there's no guarantee that it's actually as private as you want it, maybe want it to be. And then on the patient's end, because it is meant to be private, not all patients take it as seriously as other people, and they don't have it as private as it could be. And that might also make the professional on the other end, assuming they are truly professional, also uncomfortable and not want to like deal with you. Like, I don't know, there's just a lot of, like with therapy, it really is a lot of issues of like personal privacy and information security and stuff like that, because a lot of that information can be weaponized against you. And it's really unfortunate, but it is true. So I don't want to have to deal with anything like that. I may, when I get to the surgeon's office, I might bring it up with one of the nurses ahead of time and just be like, hey, so this is an issue that I have come up with, that I've encountered with my adjuster. I don't know if you have the ability to suggest something like this, but because it is the surgeon's office and it's like they are in charge of the big event, maybe they could put into my notes that like therapy along with PT during the healing process at the very least could be beneficial as a suggestion. I don't know. I'm hoping that maybe they could at the very least just be like, hey, this might help. And maybe that would help me out some. I don't know. It's just, I don't know. That's where I'm kind of at mentally, which, you know, I think it makes sense that when people sustain injuries, when people go through big events, like obviously some trauma is natural, and I don't think it's going to be for the rest of my life sort of thing. Like I don't think I will be agonizing over this the same way that I agonize over other things that have happened to me. But I also feel like I could move through it more efficiently and faster, and coming out stronger on the other side with assistance from a professional therapist, if that makes sense. Like I've always done very well. I've always responded really well to just like talk therapy. Yeah, that's just kind of it. I've always just responded well, and I would like to, for a little while, go back just so I can talk through how the isolation has made me feel and how the adjusters have on occasion made me feel, especially when it comes to the fact that they've never acknowledged my pronouns or my chosen name, etc. It's I don't know. I don't know. It's just been a lot. But I am getting to that point where it's like, all right, we're coming up on it. And I think that's part of why, like, when I got so stressed out that I threw up and then did that thing to my eye the other day, um, like, I didn't even feel in that moment, like, super anxious or super scared or super upset or anything like that. I just had a lot of thoughts in my head and a lot of uncertainty about, okay, what if I'm on crutches and something like some freak accident happens and I hurt myself and then I'm out financially because my injury no longer is related to my work injury and something goes wrong, you know. Um I know that technically I still have a job at my workplace to assist with the load. They hired somebody who used to work there, and he's been fired 3 different times, and he's somebody that I said I would never work with again, and they hired him back. And I don't think they would stop me from also working there with him, but it creates uncertainty for me because working with him truly was horrible. And the only reason I really have a lot of security at this job in the first place is because the owners know how hard it is to get a job when you're visibly trans, and they are very empathetic to that. Not all the places in my city are like that. Most of the places in my city are not like that. I have applied to most of the places in my city multiple times. They don't like it when you have a different name than what is on paper. It irritates them, to put it lightly. They don't say that, but you can just tell, like, the most basic observations of body language will just tell you that they see you differently as a candidate for a job when they know that you come with like extra information. I don't know how else to classify it. They're like, if they think you've got too much going on with your personality or your lifestyle or whatever, like, you can just kind of tell that they're like, oh, I see you as a hassle because I have to see you as something other than what I want to presume. And it's not necessarily active hate, it's more just like passive annoyance, right? So I've just been working at this job for a really long time because I know at the very least if something goes wrong with that job, it's not going to be because of who I am as a person. Like I said, they hired this guy back. He's been fired, was it 3 times or was it 2? I don't know. There's also been moments where he's walked out of the job more than once and they've let him come back. So let's just say I know that I have job security as long as I'm willing to show up and do the work. And so I'd like to keep working there. I kind of also want to go back to school, even though it's really expensive. Because I have always wanted to finish my degree. Like, I have the 2-year degree. Like, I have an associate's degree in fine art, but I've always wanted to go back and take some more of those like higher level art classes and like really push myself to get technically better and things like that, and have the peer experience. And I don't know, like, I've also always wanted to take a ceramics class, to be completely honest, and like kind of expand my repertoire of skills that I've tried. I've thought about maybe doing school part-time and going back to work part-time, but I don't know how that's going to work financially. And I don't know, it's just I've been thinking about a lot of things. And I'm also at the time when I threw up and then my eye busted or whatever, I was just like, okay, what if I try that? What if school doesn't work out? And then what if me going part-time on this job also doesn't work out? And then I'm just like out of luck. And I don't know, like, none of those things necessarily registered as I don't need to worry about this very second and it's stressing me out. So I just didn't clock it as being as stressful as it was and when it all happened. So I don't even always notice my own anxiety, I suppose, even after being diagnosed. Like, I started seeing professionals when I was 10 and I was diagnosed with most of my diagnoses by the time I was 12. Even with all this time, like, sometimes it does just help to have that professional in the corner that can kind of guide you through. Like, it's not about stopping thinking about stuff, but it's like having someone to guide you through so that you can come out on the other side. Maybe you don't even necessarily come out with all of the answers, but you do come out feeling a little more balanced in mentally. I just feel more balanced and I feel more like able to contend with what I'm thinking about, I guess, if that makes sense. Just with the help of somebody professional. So I'm hoping that maybe I can still see somebody or figure out something like that. Um, because I do find that I think it would be really beneficial. But yeah, that is where I'm at mentally with that. Let's see, what else have I been doing? Oh, I started a baby blanket. This is only my second baby blanket ever because when I started crochet, a lot of people do baby blankets. There's nothing wrong with that. I didn't want to be one of those people who, if I'm going to get yarn commissions, I just don't want to do a bunch of baby blankets and baby clothes and baby stuff because that's like what a lot of people do. And there's no shade. It's just not for me. I wanted to always just do stuff for like adults and teens and like, I don't know, like the big hoods that I make and the sleeves that I make and stuff that's like for people who are old enough to go out places, cute outfits and stuff like that. So I'm making my second baby blanket ever and I'm really kind of excited about it, to be honest, even though normally I don't feel like I would be. It's a baby shower gift for two of our friends. And what is it? It's the Trip with spelled with two P's, TRIPP, the Trip blanket, and it's like a filet crochet pattern and the filet leaves like little rows of dinosaurs. And I don't know, I think it's gonna be really cute. I'm doing it in like a really soft baby blue and like white, so I think it's gonna look nice. I've been participating in Mend March. I'm a little bit behind, not gonna lie, by like a day, I think. Which Mend March is basically what it sounds like. During the month of March, the creator posts prompts for every day of March, and every day is something that you interpret however you want to interpret the prompt, and you incorporate it somehow into your visible mending. Like, let me see. Oh, I think I showed the other day, I showed my baby blanket with the fire patch over the hole that I had done, like stuff like that. One of the days was rotten. I don't have any clothes that are fully and for real rotten, but I did show my patch pants and talk a little bit about that because people look at them and I think that they think that they're rotten. So like it's basically up to your interpretation. I've been enjoying that too. I've got some books that I have been wanting to start, or some books that I've also already started and need to finish. I started like right after it came out, I bought and started reading No Spiritual Surrender, and it is so good. It is so good. But it's also like very heavy, and it gives me so many feels that like I read it and then I put it down, and sometimes I go back and even just reread what I already read just to take it in a second time because the writing is just really fantastic. And I've also got a couple, like 3 different books that are all nonfiction that are written by trans men that I want to read. I'm considering doing like, I don't know if I would call it a book club or book review situation, but I do feel like books like that don't really get a whole lot of time, like on BookTube or Book Talk or any of those places. Like, and I thought maybe I could be the one to talk about them since I don't see people talking about them. And I'm sure people out there are talking, especially No Spiritual Surrender. That one I do know that people have been talking about because it is really fantastic. But yeah, I've been thinking about maybe a venture like that could be fun. I've been doing a lot of like, I repotted some plants. My aloe needed bigger plants. I've got a pothos that started right before the frost in January. It had been like our last surviving one because technically they weren't mine, so I wasn't tending them and nobody else was either apparently. So I brought the last one in. I had it in a jar. It had a leaf on it. I thought the leaf was getting bigger at first, but then it started to like look a little sad. So I investigated the plant further and the roots were getting all fucked up. So I chopped the roots off and it has sprouted a new root and it has sprouted a second leaf, and it's about to, actually it's right over here, it's about to get a new leaf. Okay, there's the root. And then this was the first leaf, and then we've got the second leaf, and then on the side of the second leaf, I don't know if you can see it, it's like right there. There's another leaf that's just starting to poke out of the little, I don't know what you call it, the little protection thingy that grows so that the leaf can form. I know there's like a technical gardening term for that. I'm just not sure what it is. So I'm really proud of that, just because, I don't know, I kind of thought it was just gonna die. But it's been very resilient, and I'm excited. I'm hoping that it flourishes when the warm weather happens, and I'm not gonna ignore this one because I really thought that my roommate had it covered. Which, no shade to any of my roommates, but I should have known better when it comes to plants. I just should know better. Because I've watched them for years with their methods. Oh gosh, I'm not saying that they are bad at it or that they don't care about it. I'm just saying they have a very full schedule already, and perhaps I could have stepped in sooner to help. That's what I could have done. I could also suggest that they stop putting ice in the desert plants, because I don't know who told them that was okay. I'm sure someone did. We'll figure it out. All of my cacti have been like together the whole time, so they are all still thriving. My cat does knock off. I have bunny ear cactus, which means they sprout a lot of extra little sprouts, and my cats tend to like to knock them off of the cacti, and then I just stick more of them in the dirt, and the more of them just sprout. I don't like that they knock them off all the time, but I do think it's kind of funny how many tiny cactuses I have now. Anybody who says that cacti, anyone who says that they are cat-proof plants is a liar who doesn't know cats. I've had more than one cactus be killed by a cat because the cat was, the little scent things that they have on their cheeks where they rub on it and it gives it their scent, and then it's like they're claiming it. I've known more than one cat rub their whole little cheek sacs all over the cactus and actually push the spikes off of the cactus and leave the cactus naked and unprotected just because they can. Cats are insane. Like, no plant is cat proof. There is some cat out there, no matter what plant it is, that will fuck it up. That's what I know about cats. I love them, but they will destroy an environment if they feel like it. They just gotta be in the mood, the time, as long as the planets align. Where are we at? We're at 28 minutes. We're close to 30 minutes. I've just been sitting here waffling for 30 minutes. What else did I have to say? I can take all my medicines. Oh yeah. No eating for 8 hours prior. I kind of thought that it would be more than 8 hours. I don't know why. I just kind of did. I can have clear liquids up to 2 hours prior to surgery. I will probably wait a little bit longer than that just to stay on the safe side. And they gave me some special Dynahex 2, the sequel. It's like this special soap that I'm supposed to clean with for a while before the surgery, and also the morning before I'm supposed to clean with it an extra time. This product may cause a severe allergic reaction. Probably not in me, but that's good to know. Do not use in the genital area. I do have to use it like on my hip, so I don't know if that counts. Yeah, labral tears suck. If you ever get one, just know it's some bullshit. I think that's all I really have to say. Labral tears are bullshit. If you take nothing else from today, that's what you need to know. Thanks for watching, guys. I'll see you next time.